Hello, in this micro lecture, we're going to discuss how to prepare for a multidisciplinary conference in 5 easy steps. Step 1. The first step in preparing for a multidisciplinary conference is to obtain the patient list of patients who are going to be presented that week at the conference. This should be done in enough advance time that you can ensure that the patient list is complete and covers all of the patients who will be presented, and it allows you enough time to ensure that the appropriate imaging is housed in your PACS system or is easily accessible to you in order to review the images and to present the cases. The next step in preparing for a multidisciplinary conference is to ensure that you have reviewed the medical record in enough depth that you can make sure that the diagnosis and treatment is well known to you and that you are familiar with what the case is about and that you can understand what the imaging findings represent and how it responds to patient treatment, progression or regression of disease, or the acute care of a patient who's being presented in that session. Step 3. Ensure that you review all relevant imaging, particularly for cancer patients who have multiple studies. You want to ensure that you have reviewed their initial presentation imaging study because recurrences very often will present in a similar manner to the initial study. Ensure that you have reviewed everything that is relevant to that patient's care to that point, and that you are familiar with all of the appropriate imaging findings. Step 4. Ensure that you know what clinical question the team presenting the patient from the clinical aspect is requiring so that you have all relevant images available readily and can be shown immediately when they are discussing the patient. If you are a trainee, ensure that you review all imaging studies and the clinical question with the faculty who will be presenting the case with you at that meeting so that you have all relevant information and images available immediately. And step 5 really is more about the presentation itself. When you are in the room and preparing the patient to be presented, you should always be prepared. Present with confidence. Make sure that you are presenting the pertinent and relevant images. Do not spend time scrolling aimlessly through a case without having recognized which are the important images to show. Ask the audience members for questions. And if you ask for questions or are given questions, make sure that you listen to the questions thoroughly so that you understand what is being asked and then you can succinctly answer the person's specific query. If you are presenting summary information about the case, make sure that you are presenting it in a concise and focused manner. If you follow these 5 steps, you will have a successful way of presenting and preparing for a multidisciplinary conference. Thank you.